A game-changing study has just been released, showing a 20% reduction in heart attacks. Let's have a look at the results, and then go through how this will radically change healthcare. It's called the Select Cardiovascular Outcomes Trial. It was a double-blind trial that looked at semaglutide, so that's the diabetes and weight loss medication, and compared it to placebo, and it wanted to see whether there would be a reduction in heart attacks over a period of 5 years. The trial enrolled over 17,000 adults who were overweight or obese, but had already had a heart attack previously. Importantly though, they had never had a history of diabetes, so we already know that for type 2 diabetic patients, this class of medication reduces heart attacks. What we don't know is whether it will reduce heart attacks for non-diabetics who are overweight or obese. And what the study found is a statistically significant reduction in heart attacks by a whopping 20%. This is a huge deal because despite what diet and keto influencers will tell you, reducing your weight and keeping that weight off is incredibly challenging. We've got very good research showing that on average, most patients who lose weight, they will regain 80% of that lost weight by the 5-year mark. This is because as people lose more and more weight, they fight an increasing battle against their biological responses that oppose further weight loss. To make things worse, from all of the long-term randomized clinical trials that we've got so far, it doesn't appear that there's one diet that's better compared to another in terms of long-term weight loss. I want to stress that point. There is no universal diet that results in weight loss for everyone. What matters is that you find a diet that works for you. Particularly because we've got very good research showing that the carbohydrate insulin model of obesity, it has failed experimental interrogation. That model is often used for people who are on the keto or carnivore diet. So again, if that diet works for you, brilliant, but just know that it doesn't work for everyone. Which brings us to why semaglutide, which is a class of medication called GLP-1, is so game-changing. We've got research showing that compared to placebo, semaglutide results in significant additional weight loss compared to just diet and exercise alone. So the fact that we've now got proof that semaglutide not only helps people lose weight, but it also helps reduce future heart attacks is a huge deal. Because at the moment, one of the biggest barriers for people to get onto this therapy is cost. But now that we've got research showing that this therapy reduces heart attacks, governments and insurance companies, they have to get behind this therapy. Now, online you'll see some scaremongering about GLP-1 medications for their weight loss effect. The two big concerns are cancer rates and a loss of muscle mass. Let's go through each one. We've got fantastic research from a 2022 meta-analysis showing that GLP-1 medications have no effect on thyroid cancer. There's also no increases of pancreatitis or pancreatic cancer, and from a 2023 analysis of real-world studies, they show that GLP-1 medications are not associated with any types of cancer. And this conclusion is supported by a high grade of evidence. The next concern is around muscle loss, but we have to remember that any type of weight loss overall will result in muscle loss as well. So however you lose weight, whether it's just by diet and exercise alone, or through bariatric surgery or medications, you will lose muscle mass. And generally, the lost fat mass compared to lost lean muscle mass is a ratio of 2:1, and that's exactly what we see by using GLP-1 medications. From the extensive research we have today, GLP-1 medications, the proportion of fat mass to lean muscle mass lost is not any different compared to other weight loss strategies. But to reduce this loss in lean muscle mass, it is critical to do regular resistance exercise. And to sum things up, we've got fantastic tools available to us today to help patients on their weight loss journey that not only helps them lose weight, but also helps to protect against heart attacks. And GLP-1 therapies, they are very new, so make sure to subscribe as I keep you updated with all of the new research that comes out. And make sure to check out this next video here on the 7 critical blood tests that you should definitely get to further help improve your health.